everyone, welcome to my classroom. Today I'm going to be teaching you about how to identify delirium in pediatric hospitalized patients. So the reason why this topic is significant and I want to discuss it with you is because the prevalence rate in the acute care population or ICU population is about 13 to 28%. And these kids who are in these environments have experienced disturbing hallucinations that are really traumatizing. And so it's our job as competent healthcare providers to recognize this and intervene when possible. So one of the things that makes this topic really important is, like most hospital-acquired conditions, it increases the length of stay, it increases mortality rate, and it results in poorer outcomes, unfortunately. And acute care just happens to be a precipitating factor of all of this because it leads to isolation, dehydration. A lot of kids are NPO or even adults, and so they're not getting the required nutrients and fluids that they need, even though they're on IV fluids. Disturbed sleep, immobility is a big one. And so that's why they're really important. Other than the financial burden in PICU, they found some reports that it's an 85% increase in PICU costs just due to delirium, which is definitely outrageous, and we want to try to avoid that at all costs. So one thing is that they don't really know the pathophys or why delirium happens. So they're still trying to figure it out, obviously, but there are a few theories. They have listed 3 different types of delirium, and that includes hypo, hyper, and mixed. So hypo is actually the worst. I will talk more about characteristics later, but just for this one specifically, it's related to inattention and lethargy. So now I'm going to talk to you about risk factors for developing delirium in pediatric kids. So risk factors. First risk factor is age. So the thing about age is actually kids that are less than 13 years old are more likely to get delirium or acquire delirium in a hospital setting. And they found one study that kids that were between 16 and 18 years old actually were experiencing delirium 19% of the time. So the next risk factor is sex. And typically delirium happens more often in males, and there is a range from certain studies anywhere between 21% to 77%. So clearly being a male is a huge risk factor for developing delirium if you're in a PICU. Okay, so now we have anxiety. And I'm just going to write the other 2. Okay, so if children come in with already pre-existing anxiety, they're definitely more inclined to get this delirium, hallucinations, again, characteristics that I will explain in a moment. They're at an increased risk, and they're typically experience the mixed delirium, which I discussed previously. I didn't go into detail, but is one of the 3, hypo, hyper, and mixed, I'll reiterate. And so the next risk factor is developmentally delayed, and some studies found that in 24% of their patients, about 1/3 of them were experiencing delirium. that's a lot, that's a huge number. So if you have a large number of developmentally delayed children, or even adults, again, just be aware that delirium happens in about 30% of them. So the last risk factor is mechanical ventilation, and this is one of the biggest risk factors, actually. Being on respiratory support causes a bunch of other different issues, including delirium, and the range for acquiring delirium was 53 to 85%, so it's a huge deal. Okay, so now I'm going to talk about the characteristics. I just want to point out that all of these characteristics that I will discuss in a moment actually are very, very similar to adults. So this discussion is relevant to both patients in adult and pediatric populations. They use a screening tool. There's a different kind, but the one that I know of is the DRSR-98, which is the Delirium Rating Scale Revised. And they found that, again, that almost all of the symptoms or characteristics that the pediatric patients were experiencing, the adults had them as well. So it's definite crossover. Okay, so now on to characteristics. So there are 5 main characteristics that these patients experience. And so let's start with agitation. So the first characteristic is agitation. The second characteristic is disorientation. The third is hallucination. The fourth characteristic is inattention. And the fifth characteristic is sleep-wake disturbances. So, of course, there are varying different clinical signs, so you just have to use your judgment. And one thing that I want to point out is these are the 5 main ones, but again, there are a ton. So other ones included in behavior, which goes with number 1, agitation, are aggression, fidgeting, increased activity level, or restlessness. Disturbances in circadian rhythm, so that would be number 5. Even though it's one of the top 5, it is number 5. And that one would be insomnia is included. Disturbances in cognition and mood, so that would be disorientation and inattention. Those two kind of go together, so that also includes signs such as anxiety and depression, impaired short-term memory, irritability, language disturbance, and pressured speech. Other disturbances in consciousness include confusion or, again, disorientation. And then disturbances in perception, such as apprehension or hallucinations, and poor judgment. So for kids, it would be pulling out IV lines, which is not anything we want. So in summary, I hope you guys learned a lot. This is an important thing to pay attention to and to identify as nurses. And it's one of the top 6 preventable characteristics or conditions in adults, which means it's also highly rated for children. So let's all put on our nursing caps, do our assessments, and make sure that we prevent delirium in pediatric and adult populations. Thanks for watching. Hope you guys learned a lot.